Welcome back to Good Morning San Diego, 6:45 on your Wednesday. Okay, so look, I know a lot of us have headaches. I do every day. I sit next to Carlos and Mesqua. You know how that goes. But listen, I know a lot of you probably have the tension headaches, the stress headaches in your work, in your home life, all of that. So how do you deal with it? Why do they keep coming? So we asked our friend neurologist from UCSD Health, Sara Siavoshi, to come in. Good morning, doctor.
Thank you.
How often do you see patients for headaches?
It's so incredibly common. So 12% of the US population is affected by migraines, 3 times more common in women, so 18% of females, 8% of males. So it's just a huge issue. And the reason they end up at a neurologist's office is because it's severe enough and disabling enough that they're desperate. They need something to help them out.
And I can tell you from personal experience, I have been there and I am there. I'm always there. I've had MRIs. I've done all of the things that every doctor has ever told me to do, yet I still get them. And I'm sure a lot of people at home deal with that too. Why?
Right. So the biggest question I get is why, and then the second question after I answer that is, well, what can we do about it?
Right.
The good thing is there's a lot we can do about it. The question about why, this is a huge interplay between genetic and environmental factors. So you have a brain that's predisposed to migraines if you have them. You actually have something called a hyperexcitable brain. You have genes that have either been inherited or that have happened sporadically that create these ion channels that create a hyperexcitable brain so that you have a lower threshold for having a migraine from environmental triggers like hormones, periods, menopause, pregnancy, bright lights, loud sounds, odors, and stress is a huge one.
Isn't that interesting? So what you're saying is some people are just predisposed to it and then the environment that they are in triggers it.
Exactly.
Okay, so now what can we do to fix it?
Right, so there's a great amount of things that we can do. Number one, when people come to me and they're having headaches that are occurring quite frequently and you told me you're taking Tylenol almost every day.
All the time.
Terrible, because that causes, that's
wrong.
the wrong thing to do.
Okay.
So that causes something called a rebound headache or a medication overuse headache, where you are gonna develop a headache called a rebound headache that just no longer goes away. And it's very difficult to treat.
Okay, wait, doctor, now you're telling me I'm doing it. Now I'm
You're
also doing this
wrong.
to myself.
Yeah, so you're making it much worse by you're not supposed to take an abortive agent more than 2 to 3 times a week, and that's sort of debatable right now in the science. There's no consensus on that right now. However, it should be limited. And so for someone like you, I would put you on a preventative agent where I give you something that you take every single day.
But how is that different?
Them.
Just because it's a preventative agent as opposed to something that you treat for acute. What's the difference taking that every day versus taking a Tylenol every day?
Tylenol is a pain agent, and it doesn't work on migraine pathophysiology in order to prevent them from coming on.
I see. Okay, you know, I've heard a lot, I've heard doctors say, well, the newest treatment, the new thing people are doing now is Botox for headache. Yeah. Does that work?
Yeah, it works amazingly well.
Really?
So I don't start with Botox, but for instance, if someone like you came in and they have never been on a preventative, I would start you on a preventative, and if you failed a couple of them, which there's some great ones where we don't actually have to go the injection route, but if you fail 1 or 2 and you're saying nothing's working for me, what can we do? I would say let's talk about injections. Okay. So
what's the benefit of the injection? What's the benefit of that?
Botox is a wonderful preventative agent. So after about 2 rounds of Botox, and even after the first one, it works on something called the trigeminal system. It's the peripheral nerves around the head that prevents the migraines from going back to the brainstem and causing a really bad, severe migraine. So it's a great migraine drug.
Because the Botox stops you from wrinkling your forehead or doing all of that? Is that why?
No. So actually, no, it doesn't work that way. It's not intramuscular in the way that you get it for cosmetic purposes.
Oh, interesting.
It's injected much more superficially, which isn't to say that you might not get some of the cosmetic aesthetic benefits that you would from Botox being injected into the forehead.
See. Okay, so here's what we've learned. Tylenol on a daily basis to fight, or any kind of that over-the-counter pain agent on a daily to get rid of it. Bad. Don't do that. 2, go see a neurologist or your doctor if
Right.
you're having these symptoms all the time.
Yeah, if you're having them episodically, they're not occurring that frequently, your primary care doctor can probably set up a plan for you. But if they're, and she can even do a prophylactic, but if they're getting really severe, come see a neurologist.
Okay. Well, doctor, thank you so much for your time. This is
you.
really helpful.
Absolutely.
And I will stop taking Tylenol
Every day. Bad girl.
That is bad. All right. Thank you for your
Thank
time.
you.
All right, we're going to take a quick break. We'll be right back with more Good Morning San Diego after this.